big decisions confront us when we think about the imminent death of the terminally ill loved ones in our care. Among the emotional, legal, and financial considerations are the questions regarding what type of medical assistance your loved one should receive as the end of life approaches.
For example, if your loved one suddenly has difficulty breathing, will you allow a paramedic or an emergency room technician to administer CPR? And if CPR revives your loved one, yet he or she still cannot breathe on his own, should you allow a machine or a respirator to breathe for him or her?
It is an advanced directive which indicates that a patient should not be offered CPR or other life-saving measures in the event of cardiac arrest or other medical emergency.
DNRs. DNRs are Do Not Resuscitate Orders. A DNR in a patient's file means that a doctor is not required to resuscitate the patient whenever his or her heart stops beating. It is also designed to prevent any further unnecessary suffering.
The usual circumstances in which it is appropriate not to resuscitate are when it will not restart the heart or breathing, when there is no benefit to the patient, and the benefits are outweighed by the burden.
Although DNRs are regarded as a passive form of euthanasia, they are not controversial unless they are abused, since they are intended to prevent patients from suffering pointlessly from the bad effects of resuscitation.
DNRs are requested by and for patients who are terminally ill. This is to prevent potential harmful and invasive procedures. DNRs are also requested by very elderly patients and patients in other circumstances. Well, the purpose of a DNR is not to kill a patient, rather, it is to keep a patient comfortable when death approaches.
The DNR form is prepared in advance of any situation and is kept at home. The pre-hospital DNR form lists the name of the person to whom it applies and a time for that person. The DNR form is also signed by the person's doctor. Please take note, the form is not valid until the doctor signs it.
When this form is signed by the doctor, this means that the paramedics will no longer initiate basic or advanced cardiopulmonary resuscitation.
It is recommended that all close family members should be consulted in the decision-making. Legal guardian with the healthcare decision-making authority, individual given durable power of attorney for making decisions, spouse, and adult children and parents of the patient. And here are the facts and opinions we've got from the healthcare professionals regarding about the issue of DNRs.
I'm a student from Cebu Normal University, and here with me is Miss Precious Villaflor, a graduate of Cebu Normal University, a registered nurse, and is working in a private hospital here in Cebu. Good evening, Miss. How are you doing?
Doing fine.
I am going to ask you some questions, so go right with you.
Sure.
First of all, have you had any experiences in handling patients with DNR orders?
I have a lot of experiences already since I was a student and until I started working in the hospital where I'm working right now.
What's your role as a nurse in handling those cases?
Your responsibility as a nurse wouldn't stop when the parents would sign a DNR request or a DNR order. You still continue doing your responsibility as a nurse. Like, say for example, your patient would need suctioning, so you still continue suctioning, because in a DNR order, it doesn't mean that when the DNR order is signed, it doesn't mean you have to stop giving medications. It doesn't mean you have to stop suctioning or ambu-bagging. A DNR order is, once a DNR order is given, it means that the doctor would not intubate the patient, or the doctor would not order for medications like epinephrine to be given so that the heart would stop pumping. So you still continue taking care of the patient, doing bedside care, and all the rest. So you continue being a good nurse, or taking responsibility as a nurse.
For you, are DNR orders ethically acceptable?
For me, by ethical, it means personally what is good or bad, what is right or wrong. So it only depends upon the situation. Say for example, the doctor would appraise the family that their patient or the client, when resuscitated, would not be revived anymore. So why do or give to the family the burden of spending much for the hospitalization when in fact we cannot revive the patient? So it only depends upon personal value. So like if you, for yourself, you would adapt to the DNR issue, or like if I would adapt to the DNR thing, then it depends upon you or me as a healthcare provider. So it varies from people to people with different values or different standards or norms.
So that's it. So thank you, ma'am, for your time.
Thank you, Loy.
So.
I'm April Rose Alveras, a nursing student from Cebu University, and I'm here to interview you about your view or your opinion about DNR, or Not Resuscitate. Sir, what is your stand on DNR?
DNR. Actually, if you would say DNR, do not resuscitate, we cannot deny the fact that it involves life. That there is life, even if you would say a person is unconscious and he needs to be resuscitated, but there is still life. I would say that I do not approve of DNR.
What is your stand about DNR based on the principle of stewardship?
Again, as I've said earlier, that life is given to us by God. We do not own this life. He has entrusted it to us. We are but stewards, so we need to take care of it, and we should not decide on how we should end it or when it should end. So if any person, if for example through DNR, would decide to end another person's life just because he is terminally ill, then that person has gone against what God would want him to do as a steward.
When do you think it's CPR futile, sir?
There are indications to CPR. As I have said, cardiopulmonary arrest is done when there is cardiopulmonary resuscitation is done when there is cardiopulmonary arrest. But if it is not a witnessed arrest, that means, as you know, Magod, in reviews, in your physiology, in first 5 minutes, the brain cells will start to die, and about 90% of the brain cells will die within 10 minutes. So if you are resuscitating after 10 minutes, the patient is already brain dead. We're talking about two types of death, man, the clinically dead, that means there is cessation of your heart and your pulmonary activity. But even if you are able to establish the cardiac activity and the pulmonary activity, but the brain is dead, what's the quality of life after? So that is what you said. After 30 minutes of resuscitation, we stop resuscitating. That's why because resuscitation at that particular time is already futile.
As a healthcare provider, sir, are DNR orders ethically acceptable?
DNR orders are ethically acceptable if you follow strictly the indications. That is, if the patient is terminally ill, meaning he will die within a couple of days or within a very short period of time, if the quality of life after resuscitation will not affect, the resuscitation will not affect the quality of life of the patient after. And sometimes, and this is the critical phase, it is the choice of the patient or the relatives. That's a very critical. Alisunon pa muna kay it will be raised to the courts who will decide who owns who. For example, a patient who wants to die. Well, there was a case, a French siguro to, he wants to die, niya, hindi mo sugot ang doktor. Niya, why mo doktor mo tabang niya? Kung commit siya og suicide na, di ba? Pero ikaw sa akong papatsyon ako, pa-inject ko ni mong lethal injection, you're the criminal. Pero og ikay mo mix sa tambal, siya mo hatag sa syringe, siya mo IV na ko, siya mag-injure. Yeah, nobody knows o kinsa gyud nagpatay na ko ba, pero technically nag-lethal injection jud ko. Kaya ako may pero di mo ko ka-prepare, di ba? Kung ako na ba? So, conspiracy, gyapon isa rin yung conspiracy. Kita mo tanan, nagtabang muna ako para mamatay. May na ba? So, that's...
Thank you, sir.
Thank you very much.